All right, so what we're looking at now is we're going to look at the processes of our vertebra, and then I'm going to show you C1 and C2. So this very first vertebra that I've got right here, this is C1, and C1 gets its name Atlas. Think about AT at the top, and this is where the skull is going to mount to these two facets right here. So the occipital condyles of the skull are going to mount right here, and this allows the skull to rock back and forth as if you were nodding your head yes. Okay, that's C1. Now C2, its name is axis, and it is the only vertebra that has this vertical process here. This is called the dens process or the odontoid process. So depending upon what you see in your lab manual or textbook, you can see either term, but dens or odontoid. And what it does is it allows the skull to rotate about the vertebral column without you having to move your entire body. Okay, just like that. So C1, Atlas, C2, axis, dens process. Okay, so I'm going to go down to this lower vertebra here. I'm going to go over the processes, what makes up our vertebra. So the first thing that we want to do is we want to be able to identify which is the anterior view, which is the posterior view. So this is the anterior view right here. Okay, so if somebody's walking up to you and they're looking at your chest, this is what they're going to see right here. And this part right here, this is called the body. So this is the body. And extending downward off the body, here and here, this is these are called the pedicles. Okay, so here's the body, and here are the pedicles. Now you've got two processes that extend outward on both sides. These are called the transverse processes. So one here and one here. So transverse, think about the transverse plane. All right. Now coming around, we've got some more bony tissue here and here. These are called the lamina. Okay, so the lamina here, and then the most posterior aspect of the vertebra is this process right here. This is called the spinal process, right along through here. So if you ever had your back checked for scoliosis, and the clinician says, okay, can you bend over, and they take their fingers and go down your spine, this is what they're feeling. And what they're feeling for is to see if there's any lateral curvatures on either side or maybe both sides to indicate that you had the beginning stages of scoliosis. Okay, and then the last thing is this. We've got 360 degrees of bony protection that creates the vertebral foramina, and this is where the spinal cord will be housed, in this right here. Okay, so one more time, this is the anterior view, this is the body. From the body, we've got the pedicle on both sides. Extending off that, we have the transverse processes. From there, we have the lamina. And then from there, we have the spinous process. And that's the most posterior aspect. Okay, so any questions on those? All right, awesome. Okay.